So the next topic is trachoma, which is an important topic. It is the most common infectious cause of blindness, and there will be two diseases in trachoma. One is infection, which occurs mostly in children, and the second one will be blinding sequel, which is seen in adults 40 years later. The risk factors are endemic areas, crowded living conditions, poor water supply, poverty, and domestic animals in close proximity. The transmission occurs by the help of flies, contaminated fingers, and fomites. So, clinical features. It can be acute. In case of acute condition, the patient will be having hyperemia, chemosis, water discharge from eyes, and photophobia. In late stages, the patient comes with foreign body sensation, tearing, and decreased vision and photophobia. There will be sago-grain follicles can be seen, heartburn pits can be seen, Art's line can also be seen, and there will be late sequel of symptoms like trichiasis, tylosis, medarosis, and entropion. So WHO graded the trachoma into 5 types. One is trachoma follicular, next is trachomatitis inflammation, and next is scarring, next is trichiasis, and the last is opacity. Now comes the management part. Safe strategy can be used like surgery, antibiotics, facial hygiene, and environmental improvement. And there is also a blanket therapy is given, in which we give 1% tetracycline ointment for 5 days in a month for 6 months. And if there is active infection, then the drug of choice will be azithromycin 1 gram single dose, and doxycycline 100 mg twice a day for 1 week can also be given. And we can also give a topical tetracycline or erythromycin for around 6 weeks. If the patient presents with the late stage, then we do entropion correction by the help of BLTR, that is bilamellar tarsal rotation, and trichiasis can be done, and corneal opacity can be corrected with the help of keratoplasty or optical iridectomy. So now comes Vision 2020, where the aim was to correct vision 20 feet by 20 feet by 2020. So it includes diseases like cataract, trachoma, childhood blindness, refractive errors, and river blindness. But in India, we also include diabetic retinopathy, corneal opacity, and glaucoma.